Welcome to part two's video on why somatics belongs in the massage field. So if you missed part one, I was talking about a specific person in the massage field that made a post saying that therapists shouldn't be taught or learning trauma-informed practices or doing somatic work in massage sessions. And this has been my response to this. So in part two, I want to cover why it belongs in the massage field some more. So, as licensed mental health counselors, right? So we're talking mental health counselors, we're talking marriage family therapists, we're talking psychotherapists. They can't offer somatics in their treatment rooms because insurance doesn't cover somatics. They are locked in a box of the treatments that they are allowed to do, and it doesn't cover somatics. So what happens is these licensed mental health therapists are having to create dual businesses where they have a practice for mental health where they offer CBT, DBT style counseling, maybe EMDR, which is a somatic practice that is allowable by insurance standards. And then they have to have a cash paying business as a coach to be able to offer somatic based work. So a lot of people don't know that. This is why I stopped pursuing my master's degree for clinical mental health counseling, because I can't do the somatic work that I am passionate about. And I know how much this helps those with mental health conditions. And I know that because of my own personal experience that I had with my debilitating anxiety and going through massage school and how much that helped me. So yes, it belongs in the massage field. I am living proof, walking proof of that. I was someone that couldn't even talk to someone that I didn't know and make eye contact without having a full-on breakdown. Like, I had agoraphobia. I couldn't leave my house for a portion of my life as a teenager. Can you imagine? But as I went to counseling, as I was trying different medications to help, I was able to break out of that cycle enough to go to school for massage, and my whole system changed from learning skills that I learned as a massage therapist, which was learning how to regulate my nervous system. We just didn't have the language for that at the time. And it was learning how to be present. It was learning mindfulness. It was learning all of these different skills, breath work that allowed me to settle. Plus getting regular massages, which helped to soothe my system and give me the space that I needed inside to better deal with whatever life was throwing at me. So I am living proof at how beneficial massage is. And these practices that we learn that we can teach our clients as bodywork therapists. This is part of what we do. So I know some people don't know that clinical style mental health therapists can't do the somatic work unless they are doing it from a cash pay perspective as a coaching business and not a therapy practice. So that was something that I learned in my journey of going back to school. And so I stopped. So now I'm staying with what I'm doing because I want to focus on somatics. It's what I have been training in the last 5 years. So 5 years of education in somatic work. And I can tell you everything that I have learned is stuff that I bring into my treatment sessions because it's within my scope of practice as a massage therapist. All right. So part two, think about it from the lens of medical massage. Okay. As a clinical massage therapist, right? I went to school, got a degree. I do medical massage. I take insurance. So for someone that has a doctor's prescription for a medical massage appointment, for working on a specific injury or condition, sometimes it's a whole body condition. Like I get a lot of fibromyalgia clients. I take that, I see the prescription, I take the intake, right? We are allowed to take in the health history and the intake. We're allowed to even do the same diagnostic style practices, kinesthetic practices that PTs use to help with our own internal understanding of what's happening in the body. Now, we can't use those muscle testing practices to create a diagnosis like PTs do, but as massage therapists, we can do those same practices to understand what's going on in the body so we know how to work with the body. So like I can do the same testing to test to see if the client's got frozen shoulder or thoracic outlet syndrome, or what is specifically going on, what muscle is actually the one that is the culprit. And so I can do that style testing. I can't use that testing to tell the client a diagnosis, but I can use that testing to know how I'm going to treat and approach the body, right? So this is how we walk those fine lines of keeping it within our scope of practice as a massage therapist. Now I can tell that client, hey, I suggest that you ask your doctor to be tested for this, right? And let the doctor provide the diagnosis, and you're just giving the patient maybe some insight or the terminology to use to ask to get to what needs to be done. So this is where we walk that fine line as massage therapists and staying within our scope of practice. Now, think about this aspect of medical massage and what we do with that, but now turn it into how we apply that even with the mental health field. If you have a licensed clinical health therapist, mental health therapist, send you a client because they have a lot of anxiety and they need help with relaxing. They need that break in their nervous system so they can stop that vicious cycle of anxiety, right? So now that psychotherapist is sending you a patient for a massage. But if you don't have training to understand the nervous system communication, to know the different practices, different tools, different techniques you can use to help that, it's left to the basic massage. So even with a medical massage client coming in for, say, fibromyalgia, yeah, you can work on them doing a basic massage. But when you have the additional medical training, it heightens that level of understanding of how to actually work with that patient and treat the body on the table. The same with somatic body work. You learn additional information and understanding of the body, and especially the nervous system and the neuromuscular connection, the neuroscience behind what we're doing to better help that person on the table that has anxiety or depression or PTSD or any myriad of other mental health disorders. So this is where, this extra education is continued education from the basic standard of massage. And so using that same lens, that same thought process around how we can do medical massages and bill insurance, now we're looking at, how do we stay in our scope of practice when a mental health therapist sends us a referral? The same way. We are still doing a body-based practice. And when we specialize in somatics, we are still working with the body, because that's what somatics is. Soma is the body, but not just the physical body. It's the body-mind component. It's the understanding that the body itself also contains the gut mind, the heart mind, and we have the brain mind, right? And we learn how to influence and work with those three states of the mind, of the body-mind aspect, and we bring that into the session. We bring that knowledge, that understanding, and the ways that we need to work with the body in the session. So how is that any different from someone that offers medical massage in the realm of keeping it within the scope of practice? And if this person had done any research at all, they would know these things, but they would also know that there's also already states that license massage therapists as somatic practitioners. I know because I'm living in one. So here's a person that writes a textbook for the massage field that doesn't know these things, sharing her beliefs and opinions that don't really match up with where we are currently at and what is relevant in our field. So, what do you think? Do you think massage therapists should be doing somatic work? Have you received somatic work? Do you understand what makes it different from a regular massage? I want to know, because this is my passion and this is also what I teach. This is important work that we're doing, and I am a walking testament to that. And I have several clients now that are too. So let me know what you think.